Today's a very special meeting, as we're going to have a very special guest come and present for us. But first, a couple of announcements. We have the website up and running and has projects featured on the website. If you visit responselab.stanford.edu, you'll be able to see those. And please feel free to send this website out to anyone you might know who would be interested and fired up to contribute to this initiative. We're very much looking for people to get involved and help out with these projects, and it's going to be a wonderful opportunity for everyone. Just a quick announcement on media. We are open to hearing ideas about how we can get the word out there. So far, we've been featured in the Stanford Global Health Initiative's daily COVID-19 email, and we are going to get a feature in the Stanford Daily pretty soon. And in a few days, we'll be also featured on ABC7, which is pretty cool. For some of the projects out there that have been doing really well, we're really eager to sort of get you publicity and try to put you on the radar and get you out in the hands of people in the Bay Area. So really excited about that. So looking forward to seeing and hearing any ideas that you all have about this. For grants, so we're kind of in the process of applying for several different grants that once we get them, we'll be distributing, pro bono to teams with demonstrated need. And likewise, if you have any ideas for grants that we can apply for, please do let us know. After this call, we're going to be sending out a form for continued engagement, just to gauge which people are interested in continuing to contribute and be involved in this initiative, given that school has just started. So this is going to be very important for both us and you, as we want to make sure that we put people who are committed with teams that are continuing. And likewise, if we have team members that haven't been too involved, please don't hesitate to let us know. We want to make sure that these teams are running very smoothly. We also have a new advisor. His name is Chuck Easley. Some of you may have heard of him. He's a professor in the MS&E department, and he teaches several classes on technology entrepreneurship. So we're very fortunate to have him. We've actually already been able to introduce him to several team members who are interested in getting to know him and getting some thoughts from him. So likewise, you can go to our website and see our advisors. And if you have any desire to get some feedback and insight from these advisors, please don't hesitate to reach out to us. After this call, or actually near the end of this call, we're going to hear from some members of the Stanford Social Innovation Initiative, and they're going to be putting on a hackathon that we're partnering with. So we'll be opening that platform up for our teams as well as others, and so it'll be a great chance for you to connect with other people who are like-minded and want to solve these really important problems. So with that, I'd like to see if, I don't think Milana has joined yet. Milana will be joining, yes, she has.
Hi.
Milana, do you want to give an announcement?
Oh, no, I don't have an announcement. I'm just here to support you guys. But it's exciting. Looks like you guys have quite a bit of momentum. And because of that, my department has kind of given an official okay to affiliate with you guys, which is good. So that's kind of gives a nice window into Stanford medical community. So.
Yeah, and there's also a project going on put on by the same team that has introduced the first 911 system to India. Yeah, so Milana.
Oh, sure, I can talk about that, yeah. So basically, there's a team in my department, a number of colleagues who have created essentially the first 911 system in India, and they're looking for help to essentially provide telemedicine for Indian ambulances, because their transport times can be really long. So they were hoping to get the paramedics to sit in the front of the ambulance while being able to monitor their patient in the back of the ambulance by video, just to basically prevent them from getting infected. So it's just they need a technical solution. So that seems like that could be a nice partnership with a lot of technically minded people here.
Mm-hmm. Yeah, so don't hesitate to reach out to Milana or me or any of the organizers if you want to get involved in that. So with that, over to Nancy, and Nancy's going to introduce our speaker.
Thank you, Josh. Hi, everyone. Welcome back and good morning. Thank you so much, Milana and Mike and all of our other advisors who are joining in on this call. So our speaker today is Alice. I don't know if Alice, say hi. Okay, I think she's on mute, but hi, there she is. So Alice Bonhomme-Biais, I met Alice through a sort of community that I'm involved in called NEO, and she has some really incredible experiences. So Alice was a software engineer. She's super passionate about using technology for social impact. She did her PhD in computer science in France, and then later joined Google in New York in 2005, where she worked on a number of projects related to Google Maps and Google Web Search. And most interestingly, she's sort of in 2010, following the earthquake in Haiti, she transitioned as a founding member she transitioned to become a founding member of the Google crisis response team. So for the last sort of through her 12 years at Google, Alice has learned some of these sort of best practices and everything from building teams to product design, coding, testing. And we wanted to invite Alice here today because she's had sort of a lot of relevant experiences. And in sort of 2017, she left Google to pursue this idea of how to best use technology for social impact. So now Alice sort of focuses full time on coaching mission-driven startups in US, Kenya, and Haiti to help them build their engineering culture. And from there, I'll let Alice sort of take it away and give her talk.
Yeah, thank you so much, Nancy. And hi, everyone. It's actually super interesting to see what you guys are doing and see like the energy and the entrepreneurship coming out of this crisis. So I think that reminds me my early days also of like Google Crisis Response, when everyone got together and like, what can we do? So my goal today is to try to share the learnings that I had from spending 6 years on this team. As a technologist, so I'm not, in a medical person or like a policy. So these are my own experience and my own learnings. So I'm just gonna share. I think that would be that one. Okay, can you see the screen right?
Yeah, we can see.
Yeah, okay.
Yeah, we can see you.
Okay. And that's the full slides because I have two decks right now on my two screens.
We see the full slide
awesome.
for today, yeah.
Perfect. Yeah, so I thought that today I could start by explaining a little bit the background of how that team at Google was created, and then some of what I think the learning as a technologist working on the space of crisis response, how it is different than building technology for like regular product not used in a crisis. And then I want to spend some time for questions so that if you want to discuss about all the topics that I didn't cover, that we have enough time. Feel free to interrupt if you want at some point have a little bit more details on some of the slides. Or just raise your hand on Zoom. There's a little thing. Or awesome. So quickly, the Google Crisis Response Team, which was created in 2010, where the goal was to make critical information more accessible in times of disaster. And if you go back to the mission of Google, which is organize the world's information and making it universally accessible to everyone, it really falls into that mission that says, even if there's a crisis, we should be able to have access to critical information. And the key point here was to be able to deliver accurate information. And we can see with COVID-19 where good information is so critical. How do we know it's actually correct information, relevant, but also as fast as possible? The timing is actually very important and for many products. So that was the goal of the team. And so end of 2009 and early 2010, there was actually no team. There was mainly people at Google that would sometimes volunteer when something happened. And things changed after the earthquake, and that changed in January 12, 2010, after this major earthquake in Port-au-Prince that some of you might be too young to remember. But so that was an earthquake of magnitude 7 that struck actually Haiti in Port-au-Prince, the major city, and led to the devastation of at least 250,000 people died that day. And it really had a huge impact on the whole country. And at that time, for me, I was, my husband is French Haitian, so I'd been traveling a lot to Haiti. And a few hours after the earthquake, I got a phone call from some volunteers at Google saying, there was a big earthquake. We want to try to do something. You know the country, can you help us out? And I was working on Google Maps at that time. And so the first thing that Google did was to try to put satellite imagery, to get new satellite imagery after the earthquake and make it available to search and rescue and to anyone who could do it. And to show you the power of this satellite imagery, that's an image of a golf course in Port-au-Prince. I mean, the golf course, the only golf course actually, I think, in Haiti, in Port-au-Prince, that was pre-earthquake. This image that we got to have just less than 24 hours after the earthquake, you can see all these little dots on the satellite imagery, which represent people that moved out of the house that were not stable anymore, and that went there to be safe. And 13 days after the earthquake, that's how it looked like. And that became one of the biggest camps after the earthquake, where people who couldn't live anywhere else went. And there actually was several camps like this that developed throughout like the whole country, that the part of the country that was affected. That was the first time at that time that Google made some satellite imagery available for download for free for anyone, so that people could do analysis of images and could try to do something out of these images. But after putting this image, we thought, there's way more we can do. There's so much devastation on the ground. We actually had some calls from big organization that says it's really chaotic. We have a hard time sharing information, organizing, you know, what can we do more? So we started to put a small team together of volunteers to help a little bit like what you're doing. And so the first thing we put together was to put some relevant maps. So don't forget, it was 2010, so 10 years ago. It was, you know, technology was not exactly as it is right now. So you had a lot of organizations that have a lot of different type of information, in particular geographical information. It was really hard to know who has what, where. Some organizations were not strong enough to host it. So we worked with everyone and put that in a single place where people could find it, and it became one of the reference of people who wanted to have more information. So you could see where different like epicenters next to which medical facilities and etc. So that's what we started to put together, in particular with the Google Maps and Google Earth team. But then there was an email internally, actually, at how things happened a little randomly at MISC-Eng, I think at google.com, or about engineers discussing various things. And someone was saying there's so many people that are looking for loved ones that cannot find them because there was no cell phone, very little things were going through, very little information. And you started to have a lot of different websites popping up of list of missing people, sometimes on social media, on CNN and etc. And they say, maybe there's something that we can help here to put this data together and try help people find their loved ones. So we actually started a hackathon, a little bit like, you know, we're talking about a hackathon. We started a hackathon across different Google offices, and that was from people like in Australia to Europe to East Coast and West Coast. There was coding 24 hours, over 50 people, and in 72 hours, we actually launched a first version of a tool called Google Person Finder. Very, very basic. You know, you see, it's not the nice material design that we have now. That was like 2010 design, but the idea was that people could either search for someone that they're looking for or enter information about about someone that they knew about. And the idea was to take data from all these different like missing sites and put them in here. I personally got information from a good friend that I was trying to find information about. I enter his name and say, okay, this is Patrick, and then he's CS professor. And then I got an answer from someone I didn't know, one of his students, that pretty much put a note in that tool to say, I heard Patrick on the radio and he's safe. So after pretty much a month of pretty chaotic and say, what can we do, and discussing with people, we realized technology can really play a very big role in helping people impacted by natural disasters. And it was not just Google at the time. I think that was a lot of people in the crisis response world talk about like the pre-Haiti and post-Haiti. And so a lot of big tech company actually started also to get involved. And so a group of us went to discuss with the founder of Google and Larry Page and Sergey Brin, and say, you know, that would be worth it to actually put people full-time on a team like that. And that's how this Google Crisis Response Team was created. At the time, it was created as part of google.org, which is more the philanthropic part of Google. And we got staffed with a product manager, UI engineers, and et cetera. And throughout this time, so I spent 6 years on this team. And when I was there, we responded to over like 30 different crises, from earthquake, tsunamis, to a lot of like hurricanes, this big like oil spill that happened back, you know, in 2010 as well, fires and a lot of different things. So we responded, but at the same time, we also developed, that was a big question around how can we have a best impact? And so initially we started by responding when something happened, but then we realized that maybe where we can also have a big impact is preventing, helping people to not be affected. So we also developed a tool called Google Public Alerts that worked with government to get alerts such as a tornado warning or winter storm warning, a typhoon and hurricane, gather that and show that in different, on your phone, or like if you're searching for like, you know, a pizza somewhere and there's a tornado, we should tell you. So we started to have the two approach, the direct response when people are directly hurt, and then the how to decrease the number of people that are being hurt by helping them be prepared or know in advance. So today I'm gonna, because I think right now you're more in a phase of what can we do right now during a crisis, I'm gonna focus more on what can we do during a crisis. And having developed a tool for that, there's some design principle that I often put into 3 main design principles when you're a technologist trying to work in a crisis situation. And was that anything that you do needs to be simple, standard, and open. And what I mean by simple, it means something super simple to use. A crisis is not a time to learn how to navigate a new UI. It's not a time to, people are not going to necessarily always going to download like a new app. Or if you're under stress, it's much harder to learn how to navigate something. You just have to think about, probably everyone at some point had that experience where, I don't know, you want to go on a plane and you have your boarding pass on your phone, and then your phone just shut down, and you need to reactivate it, and the guide at the enter of the plane is like, your phone, and you're here, and then you just don't go as fast, and it's the same when you're in a crisis situation. So you need something very simple. Firefighters says, put the wet stuff on the red stuff. So that's a code that says just have something that simple so that it's easy to follow instruction. A good example of that, of a tool, is actually Facebook Safety Check in the crisis response world that was developed, I think, in 2014 or 15. It's something where it's very easy, just ask you after a big crisis, and if you're in the area of the crisis, are you safe, yes or no, right? It's very simple. It's much better than like the Google Person Finder that I talked about, which was a little bit more complex initially. Standard means you need to have a standard way of exchanging data. Whatever you do, try to speak a language that other people will understand. In the crisis response world, we use the CAP, the Common Alerting Protocol, to send alerts. It was something that was already developed by agencies, emergency agencies. We're like, oh, it's not perfect, we could do better, but the whole point was to reuse something that people knew. I think in a health space, you actually have this clinical data interchange standards consortium that works on standards. I think there are a lot of standards, so it's a little harder. I would say one temptation is be careful to, I think this XKCD drawing tells it all. Often we see a lot of standards, we see it's not perfect. So this is like, you have 14 competing standards. You get with people, you're like, why? We need one universal one. We're gonna create one that is better than everyone. And at the end of the day, you have 15 competing standards. That's exactly how this happens. So I would say be careful of that when you go in a group and you start to brainstorm, because this will always happen, nothing is perfect. So right now it might not be necessarily the right time to say to just reinvent the world. And finally, the last part is open. Having something that is open so you can easily collaborate with others, either open source, so people can reuse what you're doing, or what you call like having some APIs, opening data so you can easily exchange and people can talk to your system and you can talk with the system of others. And I'm going to give you examples that will, with Google, where we worked with something around simple, standard, open, and what it can give as a result. One example is this Google Person Finder tool. So we developed the first version after the earthquake in Haiti in 2010. It's been, we reused it several times after that. There was an earthquake in actually February 2010 in Chile. But the big thing was after this major earthquake and tsunami that really hit Japan very hard on March 11, 2011. At that time, so Google had a very big team in Japan. And so literally, I think a few hours after the big earthquake, there was a Google Person Finder instance set up for people, because right away, phone call didn't go through, text messages didn't go through. A lot of people had a hard time connecting with people. And so right away, the team started something. So how it looks, Person Finder is, again, like old-fashioned UI at the time. But that was, that's an example where you could just search for someone. You search for John Doe, and then you have a list of people that correspond to the name. And if you click on the details on the left side here, you have information about the person. And on the right side, you can have people that randomly add some notes. We keep it open where you don't necessarily need to log in, because we like, if you need to create a login and like it's stressful, anyone can just like write notes. We did that as open source. So some people could like have their own instance, but we also had an API that allow other organizations to add information. So for example, in here you could see something, it's all in Japanese, but this NHK, which is a cell phone providers, had a system because Japan is a country that is very well prepared. And already in 2011, they actually had a number, NHK, where everyone could dial in that says, I'm okay. And then you could dial the phone number of someone and you can tell, and it will reply to you if they say they were okay. So pretty much they used our API to put all their data into the system here. So you could check if someone was okay, either through NHK if you had the system, or through Google Person Finder. But some people didn't necessarily have numbers. So what happened right after the earthquake, the tsunami warning, and people literally ran out of their home and rushed into some shelters. People arrived in shelters without necessarily having a way to communicate with a family, things being down. So people started to write on piece of paper the list of their names. So here, these are all pictures of papers with a list of names and that were stuck in the door of a shelter. And that was a way to say, this is the name of our shelter, and that's the list of people that are in this shelter. So on one end, you had this Google Person Finder that have a list of missing people and family that like, I want to know where is this person. And on the other end, you have this, this piece of paper with a list of names and how, you know, it's some information. It would be great to put them together. So some volunteers had some idea and say, you know what? If for each picture that was uploaded, that was like one picture per shelter because they managed to have at least one cell phone working for each shelter. If for each picture, we could actually automatically know the name of the people there, then we could use this API to update Person Finder with that information. So, so a bunch of volunteers that speaks Japanese went and manually annotated every photo, adding that as a comment to a photo with, that's the name of the shelter. These are the names of all the person that are in the shelter. Someone wrote a little program that says for each name, would actually look into Person Finder if they can find a record for that person, and then update that record with the link to the photo and say, we saw that name in that list in that shelter. All done by people outside Google that just say, you know, that have this idea that realized there was that need on the ground. For us, we might not know. We're like, we don't know exactly what's going on the ground. This way, they actually could, there was over 9,000 pictures that were taken and put into this article, and we're able to update 130,000 names on Google Person Finder that we found in these pictures. And for people to be able to go and say, okay, that names appeared sometimes in 2 shelters because you have people with the same name, but at least that gives you more information. And this was possible because the system was designed early on to be open. We used a standard called PFIF to represent meeting people finder interchange formats. That's what it is. It's a simple like XML standard. And then we had an API, this data API that people could use. You need to vet to have a specific access to the API. We don't give access to anyone, a random person, because these are still like some private information, but that allowed that exchange. And I think that's part of what makes it some innovation and in particular collaboration in time of crisis. Another example I want to give is in 2012, Hurricane Sandy that hit all the East Coast of the US pretty bad, and in particular New York. Half of Manhattan was without power for over a week. You have, I live in Brooklyn, and I used to be in Manhattan at the time. I moved to Brooklyn in 2013. There was some subway that still didn't work after a year in Brooklyn. So the devastation was pretty big. So our team activated before, of course, the hurricane hit to help people know that they had to evacuate and where it was going. But after it was hit, we looked into what can we do? What are the problems to solve? And one of the problem was this overload of information. So you had tons of information from maps, from official information like FEMA that have different maps and spreadsheets and data everywhere. You had more local authorities like the New Jersey Office of Emergency Management. Quickly after the hurricane hit, some people were looking for like shelter. They couldn't stay in their house. They had or hotels, have to find like pharmacies and gas station. And so the New Jersey Office of Emergency Management got together a list of all the businesses that were still open, which I think is great, so people could find that. Except that was a list of a PDF on a website. That's what we see here, where you have a latitude and longitude and then name of business. And I'm like, okay, I have a list of like 2,000 businesses, latitude and longitude. How do I know which one is closer to me? I don't know. So the need here was not as much as finding the information, but being able to put it next to people. And at the time I thought, okay, one way, the thing that people usually use for geographical data, is Google Maps. So let's put this data in Google Maps. So we got this data and put the latitude and longitude on the map, and we're like, yeah, good, we solved the problem. The reality is that this data actually was already out of date because the New Jersey Emergency Office collected the data, and literally 24 hours later, it's already out of date because you have the list of open gas stations. Some already closed because they has no more gas. Some hotels realized that they couldn't remain open, and etc. So we feel, how can we keep this data still up to date? Because what I said at the beginning, wrong information is worse than no information. If there's no information, I'm going to try to check in some other way. If I see on Google Maps, it says it's open, there's some gas there, I'm going to drive there. So we thought the people that will know the best if there's some gas or not are people that are at the gas station. So we can add a feature on Google Maps where people will add a status of the gas station. And then we'll actually allow people to comment directly and specify, if I go to a gas station, is there gas? Is it open? No. And is there gas? And we're like, that's super easy. It's going to solve everything. Except that, in crisis situation, people don't check out the new cool features, on Google Maps, and they might honestly update it, and it's a different use. So it didn't really work out very much. Our data was still not up to date. And then we got pointed to this map called, that was mapler.info, and we're amazed. It's like, oh, everything was updated up to like an hour. And it was all like, not that many people knew about the site, but it was super high quality. And so we contacted the people, and guess who they were? They were a group of students in New Jersey that literally took the list, like from the New Jersey management office, and they were just in operations here, and they called every business every hour. And they had tons of volunteers, and they kept that open. So we're like, okay, so they have a way to get the data up to date, and which is great, but they don't necessarily have a way to get this data to users. And for us, we're like, we don't have the data up to date, but we have a channel, a huge channel called Google to get data there. So we worked with them, we integrated to actually put their data up to date on Google Maps so people could actually find it. And so we worked this way. We had, the collaboration here was possible, because of that integration, the standards, and like the API. So the key takeaway that I think that I want you to get from this is that very important to use something that is simple. That the best will even be to reuse tools that people already use. Developing new tool is really hard to get adoption versus if you use some tool that people already use, like, like Facebook or Google Maps or some way, that's much easier to get adoption. It's reassuring people as well. The second point is open your data. So what we see is as soon as you have data that is hosted somewhere, you're sure to always see the latest value, the latest version, versus having some file that you exchange. In crisis situation, the worst that can happen is actually sending data through email. Because as soon as you send your email, your data is stale. You don't know how it's going to be distributed. It might go and people will not know that this is stale. Versus if you send a link of a data that is hosted somewhere, people going to the link will always have the latest version. So that's something that I cannot emphasize enough is, like opening data and not sending files. Something that I know sometimes with local or government or agency have been a struggle. Back in the day, I think now it's a little bit better. Then open APIs, having a way to any system that you work on to be open to collaborate with others, either to income data, to outcome data. It's something that will help a lot collaboration. People will think about use cases that you might not have thought of, and then you can work together. And related to use case, be guided by real use cases. And that in particular true for technologists in the crowd here, where we love to think about problems, and sometimes we think about problems that are not actually real problems to solve. We think it's actually a very interesting technical problem or like a theoretical problem, but it's not necessarily the problem that people have on the ground. So, for example, this idea for us that we had where we're going to allow every user to edit the information, it's going to be super cool, we develop this thing. The reality was that indeed you can have a call center that will check on all the businesses. It's not as sexy in terms of technology, but it actually gets the work done, and that's what needed. So be guided by like real use case, and then also data. Check that your data are fresh. Try to log anything you do. Try to log and see if it's used or not. Or before working on a website and say we're going to put all this critical information on this website. If no one is looking at the website, there's no point of making sure that website are really great quality. So be very data driven. And finally, the power of crowdsourcing. In crisis, a lot of people are ready to help. And that can be super powerful. We saw that a lot after the earthquake in Japan, where like thousands of people help and say, yes, I'm at home, I'm happy to help. I'm gonna look at the picture and I'm gonna type what I see, as simple as that. There's a lot of things like that that have been done and that are very powerful. But the last thing is to be aware of, is be careful of potential negative impact. And that's something I wanna insist on a lot of. Sometimes we feel we want to help and we want to do like positive things, and we might not realize that sometimes we risk of harming people more than helping them. And the first is be careful of any information we put out there. Wrong information is more dangerous than no information. we talk sometimes a lot about like some AI. So for example, for us, we're like, oh, we could do a lot of AI parsing to try to automatically find what authorities are saying and things like that. I'm like, no, we cannot take the risk of saying the wrong thing. If we parse something automatically from authorities that says evacuate and we misparse and say do not evacuate, what are the consequences? So the accuracy of anything you do often have to be much higher than what you would do if you detect if a photo is of a cat or a dog. So that's different. Then anticipate how people can abuse your solution. So that's something I was very surprised and saddened about, is that in all situations, even in crisis, you're going to have people that are going to try to abuse some system. Some example, we saw that a lot with people, Google Person Finder. So you had gentle abuse, like Barack Obama went missing in every single crisis that that we had, but you see it, it's not true. But you also had people that started to insult other people, like really putting something that were outrageous as comments. You also know that it's not like a valid thing, but when you're looking for your loved one, it's something that can be very shocking. So we started to put some spam filtering features. And the last attack we got was in particular strong in Japan, after the tsunami in Japan, was actually people putting comments on Google Person Finder that were not accurate, that were purposely false, where there was specifically an example of a man who thought his daughter was dead for 2 days based on what someone said, and then found her in the hospital. So we detected like a lot of comments that were sent from the same IP and things like that. So I remember my faith in humanity was hurt very well when we saw that, but it's the reality. And so don't assume that because it's a crisis, everyone always come together. A lot of people come together, but be aware of how people can misuse what you're doing. And the last point is always ask yourself, if you do something, is there a risk that it might harm the people more than the people you're trying to help? It might harm them more than it will help. And for this, the example we had was again with Google Person Finder. In the spring of 2011 was the time of the Arab Spring, the Arab Revolution. And it started in particular in Egypt, I think in April or May 2011, sorry. And there were some big protests that people went, and a lot of people disappeared after the protest. So we got some email of people saying, we need to launch Person Finder. We're looking for missing people. And initially we're like, yeah, we want to help. And then someone in the team said, but it's not a natural disaster. It's a political conflict. So we need to check what's the consequences. And so we reached out to the International Committee of the Red Cross that works specifically in areas of conflicts, where there's a lot of conflicts. And we told them about, they knew about the situation, and told them, do you think that makes sense for us to help and launch this Google Person Finder tool? And they really discouraged us from doing that. They said, like, the risk was actually, if you think about it, all the friends of people that are missing will enter information there. So pretty much it's a whole social graph of the people that disappeared. The people that disappeared probably taken by the local government, and suddenly you provide them with a list of all of their contacts. And when people are in a crisis and they're looking for the loved one, they don't realize sometimes that they might expose themselves. On Person Finder, sometimes we see people putting everything all their life, like all the information about the person to be able to help find that person. And they're going to put like the number and like where they live and what they used to do and all of that, without realizing that this is out there and everyone can really see that, and it might harm them later on. So I think that's our responsibility when we build this tool, to pay attention to that. And that's sometimes something that if we don't purposely think about, we might miss. So always think about that part. What are the negative impact it can have? Even if you're really doing that on a positive mindset, that's something that I think is very, very important. And that was my last note, I think. And thank you. And yeah, if you have any questions on some point of that or on other aspects or topic.
Thank you so much for this talk, Alice. And I think I speak on behalf of everyone to say that that was incredibly informative, especially for this community. And I think for me, one of the biggest learnings is I had no idea that Google Alerts was created by the crisis response team. And I have that particular feature to thank for saving my life. About a year ago, I was driving down to Death Valley and I was planning to go camp there in the winter. And I had all my gear, I'd sort of driven the car down and I was ready to go and camp for the night. And then I remember I was with a friend and by chance we decided to look up like, hey, maybe there's some cool nearby trails we should check out. And we look on Google and it says like, alert, there's gonna be a snowstorm there tonight. And it's because of that random search that I did that day that I didn't end up going camping and I probably saved my life.
Wow, that's amazing. Yeah. I mean,
yeah,
that's one point that is a follow-up to that is one issue sometimes of product like that is how do you evaluate the impact, right? Like something, most products on tech, you evaluate based on number of people that clicks or like, you know, what do you call like click-through rates or conversion. What does that mean for product like this that are more like humanitarian? What does a conversion mean? I remember we had our leadership that says, okay, you need to tell us how many lives you're saving per quarter. And we're like, I don't know how to measure that. It's also a little bit arrogant to say, you know, I don't know if it's saving life. I think it's a combination of different things. But the fact that people took an action in their real life after seeing something online, how do you measure that? That's something that is actually really, really hard.
Yeah, absolutely.
But I'm glad, I'm glad it's
absolutely. If anything, my main learning from that was every time I go somewhere that's mildly risky, I just search that term on Google first just to see if anything comes up.
Yeah.
And it's worked a lot of the times. So I have one question for you from sort of the broad community, and then we're going to open it up to folks who are in the call. And feel free you can chat me, you can chat Josh, or any of the other organizers if you have a question, and then we'll sort of call on you, I guess. So the question I have for you is, it sounds like you've worked on a lot of different projects before as part of the crisis response initiative. And I think a lot of what you've mentioned, those projects are actually, we see synonymous projects occurring right now within our community. So for example, you mentioned there's this one about seeing if gas stations are open. And we actually have a project that's going on where folks want to crowdsource available groceries or available items in various kinds of service provider stores or sort of local supermarkets. And the question of information overload, we have, I know we have one team led by Andrew, I don't know if he's on this call, who is sort of organizing all the resources available for people in Malaysia. And he's working with the Malaysian government to sort of crowdsource this information and put it onto one central location for people to get access to, and various other examples like that. So what is, based on your experiences, what is sort of one idea out there that you think needs to be built right now specifically for COVID that you see very few people doing?
Oh, wow. That's the $1 million question, right? So I haven't been involved as much with COVID. I think I'm mentoring a few groups, but not directly involved. So I think it's not like necessarily like one person that I think is going to come up with an idea. I think a lot of the idea will actually come out of like exchange and discussion and brainstorm. So at the time, after the earthquake in Haiti, there was this recurring, like what they call crisis camps, where people were getting together when like a big crisis happened in the world, and we're getting together to really like brainstorm all the ideas that people had and like share that like type of information. And I think that's what needs to happen. I think it's okay if at the beginning you have things that happen in parallel. I think it's okay if two projects doing the same thing might start in parallel, and one of them might take off and the other will not, and then the other might just join, or it might take some time to join. Like having duplication of work is not that much of an issue. We even had that internally at Google sometimes, because I think here we're not in the part of like optimizing every single hour of work. Often you have more volunteers than ideas of things to do. So I think it's okay to just work in things in parallel. So unfortunately, I don't know exactly what is needed right now on that sense. I mean, I feel it's also, there's a lot of medical, how to support like the medical approach. I think it's more, from what I can see, some needs, but I don't know enough about this specific crisis right now. So again, like, no information better than wrong information.
Absolutely. I think that's one of the big takeaways I hope folks in this channel will take away from this call as well. So one of the organizers, Annika, just pinged me, and I realize we're running a little short on time. So I'm just gonna call on Michelle, who has a question, and then afterwards, if we have any other questions, perhaps we can take it offline. And if any folks want to reach out to Alice, and Alice, you're okay with it, I'm happy
definitely.
to connect you guys.
Yeah, you can share my email address. I know there was a question from Stella also that asked about the method we use to validate the needs. Did you follow the Google Sprint design methodology, and did you conduct user interviews?
All right, we can do 2 questions. Let's do them fast, and then, and then we can go back to the call. Awesome. So do you want to go ahead and answer, Stella? Stella, did you have a question?
Yeah, so the question about that was typed. So one method we use to validate the need. So it's like the traditional, a lot of like users interviews. So we do like the personas, like in crisis, what people need and etc. And we did, yes, some Google like sprint design. So definitely all like the traditional things, but a lot of users interviews, because you cannot rely as much on data log. And one thing is also, I think, defining the metrics early on, how you're going to measure if something is working is very important. And trying to look into how you, like your skills or your organization can have an impact somewhere. So for us, we focused on places where if there was no internet, we feel we are not the best person to try to help here. So try to help where you have your strength.
Awesome, that's wonderful. And then Michelle.
Well, yeah, hi.
Michelle,
Yep. Thanks, Alice, for your talk. I was wondering very quickly about what kind of frameworks you use to think about evaluating negative impact. Like, is there a procedure or a helpful way of thinking about impact in general? And also, when you touched on briefly, like the KPIs on humanitarian aid. So when you pitch this to like your bosses and they're giving you money to work on this, how do you create value in a space where it's hard to determine what exactly the value is?
Yeah, all very good question that we went through. I'll start with the last one. So how to pitch, I think for us, I think we were lucky, like literally the beginning was just people need help, and we have no idea how it's going to help Google, but we think it's the right thing to do. So I think in that sense, we were very lucky that we had the support right away. Later on, to sustain the team was a little, I think, harder, but I think that was really showing that it aligns with the mission, that critical information, it literally falls into like the mission. It doesn't have here like a business, except eventually like PR or things like that. The same way, like, web search, it's the same mission as web search. So there was no direct money involved, which actually makes it hard sometimes when discussing with nonprofits, because they were always asking what Google has to do in doing this. They didn't believe that it was just because we think it's the right thing to do, particularly in Europe. I'm from Europe, so everyone was so skeptical. And I forgot the first part of your question.
I was wondering about frameworks that you use to analyze like potential negative impact.
Oh yeah, so I think we didn't have a specific framework. I think it's just even being aware, and each time you work on something, think about it. Think about how it can impact people, and in particular, how it can impact people that might not be your direct users, that will be able to, that you target. So, you think about your main use case, and then you might not think about, how these other people are going to be impacted by this, right? It's like, and it's in general, like in humanitarian field. So I think each time try to put your hats and look at things from a different angle. That sometimes just even thinking about this will trigger other ideas.
For sure. Thank you.
Thank you.
That's a wonderful question, Michelle. And thank you so much, Alice, for the wonderful talk. And we have more questions from folks, and I think the best thing is we'll connect. Anyone who has questions, feel free to ping any of the organizers, and we'll find a way to connect you with Alice after this call, so you can get your questions answered, if that works for you, Alice. And with that, we'll go back to Josh, and we're going to do a quick overview of some of the projects that are going on. And Alice, feel free to stay on the call as well if you're interested.
Yeah, definitely. Want to see what you guys are doing.
Awesome. Thank you so much, Alice. This was super informative and helpful. So next, Annika is going to introduce some of the projects that are doing really well, and they're just out there making things happen, and would like to demo for you all. Over to you, Annika. Perhaps she's
sorry, I was on mute. Sorry for that. Yeah, we have Radva and Nicole actually on the call, who are introducing the Stanford Innovation Challenge quickly, like the hackathon we are posting you all about on the Slack channel. So Nicole, handing over to you for a quick intro if you're on.
Awesome. Hi. Really awesome to talk to all of you. I don't know what they've been sharing with you on the other end, but we're super excited. Radwa and I are helping plan an innovation challenge, and I'm going to share the website right now if I can share my screen. Just to show you real quick and answer any questions, or at least give you the connection, and then you can ask us questions directly. Can everybody see this? So this is the website. We have an innovation challenge coming up next weekend, and here's exactly where you can apply. And we are calling students everywhere to be able to join this and help develop solutions around the social and economic challenges around COVID-19, especially these like longer challenges that are going to persist for a long time. And we have these particular challenge areas of focus that we're going to provide a lot of support around. So teams focusing on these different challenges get briefs. And it's not limited to these challenges in particular. If you're working on something adjacent, we're going to be offering coaching and expert interviews throughout the weekend. And we also have some prize money at the end, and some expert judging for teams that advance onto that. So we're really excited and hope that this is a good opportunity to help move some of these projects along. And then some of the teams out of the hackathon will redirect back to the innovation lab because you guys are all doing some really awesome work over here. Rad, what do you want to add?
Yeah, I just want to start by saying I'm in awe of all of the work that you guys have been doing. Just seeing how prospective students are joining the Stanford community. I feel this is the energy that I had before coming here, and I'm so excited to get this vibe again. And yeah, just to add on a couple of stuff, we have a lot of experts lined up when it comes to those different themes. And this is run by the Stanford Design Impact Program, which me and Nicole belong to, as well as the Stanford Center for Social Innovation and the Social Innovation Club as part of the GSB. We have speakers from the D School, from the business school, as well as experts in the industry as well. And we really feel like this is going to be as impactful as ideas and people who are passionate about working on this. And it can work as an accelerator for your ideas. So think about it as if you have a specific thing you want to tackle and you need to hone on for like a couple of days and like really focus on finishing it, then this might be the place for it, especially with ideas already trickling down in your program. So yeah, I'm really excited to have you join. And let us know if you have any questions.
I am putting the website link in the chat. I'm sure they have already shared it with you all a lot, but the application deadline is Tuesday, and we would love to have you. You can join as an individual or already as a team. And we already had some teams ask if 4 people is the limit. We can work around that. So just apply with 4 of your people, and then write either in the comments box or email us to add on your additional team members. And we would love to have you all.
Awesome. Thank you both so much for introducing the hackathon. And if there are no questions, we will just jump right over to the quick team updates. So we will start with Emil, who is presenting his update on Verify today, which is, as you all might have seen on our main spreadsheet, a low-cost early detection app. Yeah, Emil, over to you.
Right. Okay, thanks. It's kind of funny because we have a grant proposal due in 3 minutes, but the rest of my team is working on it, so it's good. So so yeah, basically, so the vision with Verifile, basically, a lot of people have stress right now that they don't know their COVID's risk status. So basically, like in places like Pakistan, they rush to the hospital. They don't know I'm coughing. I'm not sure. Go to the hospital and there's like thousands of people lined up. Only 10 tests are available. So there's a lot of cross infection happening. And we have similar things in US, but maybe not that extent. So basically the end vision is kind of to have a cell phone app where basically you speak, you like cough into it, you breathe into it. It takes a facial video perhaps, it takes a video of your finger, and just kind of using the smartphone to pick up on the vital signs of the body, and then kind of feeding it all into like an AI algorithm to pick up like the micro vibrations in the micro variations in the audio, the things that humans can't hear, to pick up like, yeah, and give it like, okay, 90% chance you probably have COVID, your cough sounds like COVID patients or something. And then give them a recommendation so the healthcare providers can basically decide what to do next. Yeah, so then basically, I'll give you guys, I mean, that's the vision. And so we do have a website, we're still working on it. So like, we're collaborating with Japan, and because I'm an ambassador for Japan government. I mean, in Pakistan, we have government support as well, some universities. We like this has 100,000 users in Japan, this COVID dashboard, so we'll probably integrate with this daily 100,000 users. And then our website basically to gather, basically the main thing we need to do is to gather data. So right now we're going to start gathering data from hospitals like tomorrow. So under like the proper IRB approval, and they will basically, you go here and you start recording. And basically the goal is that this web app will tell you what to do next. And yeah, and so what we're looking for is basically, let me open my notes. At this stage, our main thing is to gather data. We're working on deep learning. So if there's someone who's an expert in deep learning, maybe in the medical side, and could give us some mentoring, that would help, like audio analysis. Maybe a website developer could help as well, because our website's kind of not good. And grants, if we have someone to help us write grants, and maybe a faculty member in Stanford who could be our PI, maybe from infectious diseases or something. And yeah, and then the future direction, basically, we're hoping that this can expand to be something for even other diseases, like even the flu or future pandemics, that basically we get the system that people can use on their smartphones everywhere in the world. Yeah, so that's it.
Awesome, thank you so much. Then handing over to Casey, who will present her group's idea to democratize mental health care access.
Thanks for having me. I'm Casey. I'm working with Mika and Jamie and 2 other developers who we met through an external challenge. Our product is called Ray, and the idea behind it is that we want to create a free telecounseling platform to offer mental health care services to those who need it the most. The motivation for this is that we're seeing a huge surge in those experiencing anxiety and depression because of the effects of COVID-19. And a lot of the times, the people who are most negatively impacted are those who don't have the financial resources to access these services. So our current idea is to build an online platform and connect counselors to people who are seeking some care. So in terms of progress, we have our 2 developers working on building our platform. And at the same time, we're conducting a lot of user research, kind of as Alice mentioned. We want to make sure that we're understanding the needs. So far we are surveying just the Stanford population, but we're hoping to expand that once we get some more concrete data. Preliminary results have been very interesting and have been validating our hypothesis. Like over 60% of the Stanford students who've responded on our survey are dissatisfied with the university's mental health care services. So it kind of validates our hypothesis that there could be a space for a better service. And in terms of our aim, we're trying to get our platform up and running at the end of April so that we can start pilot testing within the Stanford community before reaching out to broader communities. So in terms of needs, we are actively looking for funds and grants. We think that funding could greatly help us recruit someone to train and vet our provider side, so the counselors, to make sure they're at a certain level of quality. And we're also thinking that getting more publicity to get counselors to volunteer for our platform would be super helpful. So kind of as Josh mentioned, getting that media exposure would be really helpful for us as well. So yeah.
Great, thank you so much, Casey. And then handing over to Thilo, who will present his website Hilferegister, which is also one stop user-friendly platform on mutual aid initiatives. So similar to what Andrew has created for Malaysia, this site is now for Germany. So Thilo, over to you.
Yeah, thank you, Annika. I'll try to keep it rather short since we've gone over time already. Just going back about 3 weeks, I came back from skiing and actually caught corona myself, thankfully a very mild case. But during that time in quarantine at home, I was largely thinking about what I could do when I was, or after recovery and coming out of quarantine, largely with the hope of having immunity and, being able to help others who are particularly at risk. And so when I started researching what was out there, it was really, really tough to find, first of all, what's possible to do in the local area. What are all the things going on there? Not because there wasn't anything going on, but just because there was a flood of information that was completely disorganized. And so with the call that we had, the kickoff call actually for this initiative, is where I met Andrew, and we had a call right after to catch up and talk about how they set up in Malaysia. And that perfectly fit the issues that I'd been facing here and that I'd previously talked to a few friends about. So within a day of that happening, we already had a team of 5 people together and start working on it. I'm just going to share where we're at the moment. So what you'll see here is the current homepage. We launched this just over a week ago and started marketing it on social media in on Monday this week. Unfortunately, at the moment, everything's in German, so you probably can't understand too much, but I think main point is we've tried to keep it as simple as possible to make it possible to find help, and particularly to make it very localized based on postal codes, and then filtering either what kind of support you want to give, be it donations, blood donations, plasma donations, if you want to just volunteer, if you want to buy vouchers for local stores, this kind of thing, or also if you need support. But looking forward, so I think in Germany, we've got a active team that's now working on largely really getting people on the platform. We've been working on improvements based on user feedback for the past week, and are really trying to reach out to the press at the moment, and have had a little bit of coverage so far, which has already been really valuable. But in order to help as many people as possible, both Andrew and I have been talking together, how can we bring this into other countries, which will probably be hit much harder than we've been here. And so while our team here can definitely cover some local geographies that we have a lot of knowledge and a good network in, like Austria, we are looking for people who are willing to roll out a platform similar to this in other geographies. And Andrew and I have been working together to put together a sort of playbook, best practice from the experience. We have 2 platforms that have now been built. One, the Kita Jaga Kita, that's up and running in Malaysia, which is based on a rather simple code base, using an existing platform, and is simple to use. The one we have now in Germany that was programmed from scratch in order to give more customization and more features on localization. But both of those are also available for adoption in any new geographies. And we're really looking for anyone who's wanting to roll this out in their geographies. To make that rather concrete, this is something we've been drafting at the moment. What we're looking at we've got this team at the bottom in dark blue, with essentially Andrew's team and my team together, some of the other people we have helping out through this initiative, are able to provide. And in the end, particularly for the local team, we need someone who then leads sourcing initiatives, filling the website with content, and then also having the network working on marketing and really making sure this gets out to people to help people. So anyone who's interested, feel free to reach out to either Andrew or myself. On the side, we're also looking for people on the tech side, so full stack developers to help us develop the platform further as well, and to make it more user-friendly and adaptable going forward.
Great, thank you so much, Tito. And yeah, I think that's it from us today. And also, Alice, thank you again so much for taking the time today. It was really great. And yeah, just in case anyone any remaining questions, otherwise, yeah, we're done for today.
Yeah, I just want to thank all these teams again. Such amazing work you guys are doing. Such amazing work. Yeah. It's really inspiring seeing, especially, you know, speaking personally, it's so inspiring seeing all the amazing things that you're doing. And I hope everyone here can take something away from this. So we'll remain on the call for a bit, and looking forward to seeing how you guys progress in the future. Thank you.